Hi, this is Cheryl Barton. Wanted to welcome you to my channel, Heart of NWA. This is where we teach you everything that's going on here in Northwest Arkansas, fun things to do, see, and go. I just wanted to talk to you today about what's near and dear to my heart is elderly and their care in their later years. I have parents right now that are needing special elder care. To be honest, it's pretty rough. Having the conversations with your parents about their needs when they're getting older, finding a place for them, whether that be in your home or it be in a facility that they can better care for them, because everybody's got special needs. It's different from everybody else. I've been doing some research for the past month, and I thought I would share some of the things that have been enlightening to me, and hopefully it will help you in your search for your loved ones too. So where do we go when we're looking for care for our elderly parents? Well, that depends on what level of care your loved ones are in need of. There's a lot of different levels, and I'll go over those with you specifically later in the video. But first, you have to have the very difficult conversation. And what that means is you need to ask your parents where they want to go in their later years. Most people will say they want to either live with you or they want to live in their own home. Some cases, that's just not possible due to their needs, their health needs. This is very difficult for me, as you can tell. I'm having to do this research for my dad right now. And he is in a facility right now, but it's independent living. And I'll go over those with you shortly about the differences in the different homes that your loved ones can be involved in. Well, the good news is there's plenty of variety of home health care, for example, that these people can come to your home and they can care for your loved ones while you're at work, or if they're just needing some extra help to get over like surgeries and some debilitating accidents that they've had. So normally when you get discharged from a hospital, when you're elderly, you have to go into either a rehab or you have to go into a home situation where the therapists come directly to your house and get you back into mobility again. And that is home health care. So independent living is, like I said, what my dad is doing right now. So this is great if you wanted to live in a community that is like-minded, like age, and you just didn't want to have to deal with, like mowing your own lawn, and you wanted to have your meals provided for you, and you can either have your own little separate cottage, or you can live in like the main building and have access to the cafeteria, the fun activities that they have there at the facility. For example, the Grand Village, everything's included, from the rent to meals, whether you feel like going downstairs and having a meal with all the other occupants, or if you wanted to have it delivered to your room. That is completely up to you. They've got activities, they've got swimming, classes, all kind of fun things that you can do to interact with your friends and your new roommates. When I say roommates, normally you have your own room, but I say they're mates because, they're right next door to you. You can visit and have fun times, playing cards or shooting pool or whatever. And that's independent living. Assisted living facility is a little bit more involved. So they have like a nursing staff or just staff on board to help out with like medications, meals, assistance, like bathing or whatever. That can be included into the facility, or it can also be an add-on to where you live. So that is assisted living. Skilled nursing homes. This is a little bit more involved. So for example, you have your medications, skilled nursing staff comes in and takes care of you, takes you to rehab, and they're on staff 24 hours a day. They're there for you in case you have a fall. If you have any kind of special needs at all, they are with you. And lastly, there's long-term care. And I'll be honest, this is the care that I'm researching for my dad right now. He's not quite to this stage yet, but I'm doing my preliminary research on what is going to be involved and what do they offer. This is when your loved one doesn't have the ability to take care of themselves. Eating, bathing, going to the restroom, dressing themselves. This is long-term care. While preparing for this video, I created a downloadable PDF from all the research that I've done here in Northwest Arkansas. You're more than welcome to download it, read it, look through it. And I really and truly hope that it helps you in your search for your loved one. This is such a difficult time for all of us that we're having to deal with this together. And I just wanted to make your life a little bit easier than mine was, to be honest, because this was a lot of research from a lot of different facilities here in Northwest Arkansas that I compiled. And I hope that it helps someone like you out there to get a little bit further along a little bit quicker. There are so many different stages that your loved ones could be in right now. And if this could help speed your research along a little bit better, I'd be more than happy to help you in any way. If you have any questions, or if you would like to know what facilities my parents are in right now, go ahead and DM me or leave me a message, and I'll be more than happy to respond to you. If I was to give any advice, I would say take baby steps. Don't jump forward too quickly. For what I mean by that is, you're probably thinking about in the long term, like what's going to happen in 5 years. Oh, maybe I need to plan for that. To be honest, from my experience, baby steps is the best thing you can do right now. Take day by day. Maybe your loved one is not going to need all that kind of care all at the same time. Just take your steps, do your research, and don't let it be a burden just on you. Rely on your friends and your family for the strength and support that you're going to need to go through this. So in conclusion, I just wanted to say that this is just a simple video from me to you, from my heart to yours. Again, my name is Cheryl Barton, and I'm with Heart of NWA.